I'm Steve Rapicelli. If you weren't expecting me, you're in the wrong spot. Here you are. So, we're going to talk about hip pain tonight. Hope everybody wants to know about hip pain. This is, as I told the group that was here earlier, a couple rules. I hope to start on time. I was 20 seconds late or 30 seconds late. I'm going to finish on time. I'm going to be respectful. You do not have to write anything down. You do not have to take notes. It's being recorded, and I'm going to send it to you if you want. Oh, thank you. You are the best, Tricia. It's a little bit dark in here so you can see my screen. I am going to talk to you like I would talk to my brother or my father or my mother or my wife. So I'm going to use, for the most part, regular words as much as I can. I can use fancy schmancy words. I can do that if you want. There's going to be some fancy schmancy slides, but not too many. I promise you, my intent is that you are going to come out of here knowing at least 3 new things to try. We're all friends here. That means that your question is probably everybody else's question. So feel free, let's make this a little bit of a dialogue. If you're thinking it, I guarantee there's somebody else that's thinking it. So let's all, chip in and help each other out. So with that said, let's get started. Do not know how trip to Mumbai came up there because I'm not going there. That's weird. All right, so this talk is how to fix your hip pain or how to look and move like a 20-year-old.
That'd be great.
Yeah, and not a 20-year-old dog, a 20-year-old human. I can't turn back the clock all the way for all of us. I wish I could, but I can't. But I am going to be able to turn it back somewhat. Why is this important? Why the heck is this important? Because you can do something about your hips. Now, I'm going to make this statement. Hips and backs are first cousins. So hip issues and back issues are often the same issues. And although we might not be able to diagnose it all the way here in this seminar, just note that, and one often is the other. And if you have a hip problem, you probably better look at your back. And if you have back pain, you better probably look at your hip. And if you have both, it's probably a little bit of both. But there's something you can do about it, right? Having a sense of you being able to do something is huge. And I'm going to give you those tools tonight. Now, before I tell you my secrets, and I got some secrets, a couple ground rules here. Look at us. We're all different. You do not look like me, and I do not look like you. We all look different, right? We have different bodies. A hip is a hip, but you're a little different from me. You are not my patient. Some of you might have been a patient of mine a long time ago, but you're not my patient now. So I don't know your particular issue, right? So just take it with a grain. Or shoes. So kind of take what I say with a grain of salt. Be a student, but don't be, you don't have to be a disciple of me. Debate me if you want. That's okay. Use your good judgment in anything that you try. Just because I'm going to show you a lot of stuff tonight, just because I'm doing it doesn't mean you should do it. I'm going to get in a couple positions and you might say, heck no, that's probably a good idea to not do it. If you're going, just because I'm doing it and I say that it's a good idea to do it, doesn't mean you should do it. So just use your good judgment. And then finally, I am an expert. I've been doing this for 33 years. There's not much I haven't seen. I am an expert, but I'm not an expert in you. In fact, you are more of an expert in you than I am an expert in you. So got it? That makes sense? And, you know, I take great stock in the patient's self-reporting of things. Like some people go, you know what, I'm just not walking right. And I went to my doctor and he said I'm full of, marbles and he doesn't see anything wrong with me, but I'm telling you there's something wrong with me. Guess what? There's something wrong with the way you walk then. And it's our job to find it out. So the hip joint. The hip joint is a deep, stable joint. It's a deep, stable joint. It's very stable. You got big bones. You got big muscles. You got big ligaments, right? This joint is meant to take a lot of your body weight, a lot of force over decades. So when things start going wrong with it, you're going to know it. It's a ball and socket. It's a ball in a socket. And there's ligaments that are around it called a labrum. If anybody ever took Latin before, back in the day, means lip. It's a lip around that cup that makes it a little bit deeper. Some of you may hear of a labral tear. That's what that is. And there's bursa around it, and there's muscles. So it's heavy, big bones, and it's a heavy, big joint, even if you're a little lady. And it's designed for movement. Around that joint, there's a whole bunch of muscles and other stuff, and it's really kind of cool. We are very, very well designed. We're very well engineered. We're designed to move. One of the worst things that we can do to ourselves is sit for a long period of time. And I don't know if you're like me, but the older you get, the more you find yourself sitting. And that ain't good. So tip number one, it's probably a good idea to start moving. On my fancy schmancy Apple Watch, it tells me to get up every hour. And I would do well to listen to that watch and get up. As a matter of fact, recent studies show that getting up once an hour and doing just 30 air squats regulates your blood sugar better than a half-hour walk. How cool is that? So if you do nothing more from tonight as a takeaway, then get up once an hour and just do this. Doesn't even have to be deep. It can be like this. Doesn't even have to use your arms. Just do this. That regulates your blood sugar. That's a good thing. But things go wrong in your hip joint, and here are the major ones. Osteoarthritis, good old arthritis, right? And looking around the room, you're all over 30, so you all have arthritis. I can pretty much tell you, we all have arthritis. Welcome to gravity. It's just how it is. It's to what degree do you have it, and if it gives you symptoms. Now, here's a little secret. I've seen plenty of patients who came in with an X-ray, and he said, "Hey, the doctor said that I have terrible arthritis in my hip. My hip doesn't hurt." Right? So you can have a lot of arthritis in your hip, and it may not necessarily be symptomatic. So just because an X-ray shows that you have an X-ray really anywhere, arthritis anywhere, doesn't necessarily mean that that's the cause of what you're feeling. All right, so that's good news. Bursitis. Now we have a lot of bursa around our hip in particular, and a bursa is nothing more than a little fluid-filled sac that provides cushion and lubrication to muscles as we move them. And bursitis, anything that ends in itis, means inflammation. So you'll often hear hip bursitis, and if you ever had hip bursitis before, you know what that feels like. It's usually red, tender, can't lie on it. That's another common cause of hip pain. Muscle imbalance and weakness. Ooh, this is a big one. This is a big one. This is where your body becomes a giant puzzle to me, because I get to figure out, oh boy, I hope I could turn that off because you don't want to see what he's going to say next. If whatever he says, just don't even look at it. Just pretend that he's not writing anything. Muscle imbalances are huge. Muscle imbalances, and we're going to talk about those muscle imbalances. They are going to result in hip pain, back pain, knee pain, ankle pain, shoulder pain, neck pain. Neck pain? Yes. These muscle imbalances. Now, here's what's cool about your body. Your body is so well designed that it can accommodate all the crazy things that you've done to it since your 20s or teens. It can accommodate all of that stupidness until it can't. And then you start feeling it. Right? So my point is, it has an amazing ability to accommodate tightness, stiffness, weakness, until it can't. So our job is to find out what that is and just kind of nudge your body back in the right direction. Once we kind of nudge you in the right direction, then your body can heal itself, and it oftentimes does. So that's good news. The vast majority of these problems can be fixed. This is a quickie. This is a lifetime of management. A lifetime of management. Right? And even though that sounds bad, you have a lifetime of management in your teeth, don't you? It's called brushing them. So if I tell you to brush your teeth every day, you're like, yeah, of course, I do that twice a day. You're going to walk out here with maybe one or two new habits that you're going to say, you know what, I'm going to try to do what that guy told me. And let's see what happens with your hips. Now, I can diagnose your hip problem. You can't. But I'm going to tell you a couple things where you can kind of sort of diagnose your problem and figure out what ails you. Part of that self-assessment and diagnosis for yourself is pain location, because it matters. Range of motion tests at home, how flexible you are, and when you should see a doctor. Now, look at this. Look at all those muscles. Anywhere along the way, one of them gets weak, and you're going to have a problem. So I don't expect you to be as good as me, but you're going to get pretty darn close. I want you to think of your hip conceptually as front, side, and back. Let's just think of it that way. For the vast majority of you, you are tight in the front of your hips. You are tight in the front of your hips because what I'm looking at right now is how you are most of the time. And that's sitting. Right? And when you sit, all the muscles in the front get shortened. So we have to reverse that. Right? Well, first of all, how can I tell if the front part of my hips are the problem? And there's two things that I say. And the first one's easy. When you go to bed, who hasn't laid on their stomach since the 80s? Yep, that's okay. You're tight. You're tight. You're tight in the front of your hips. So part of the reason you can't lie on your stomach, or you don't like to do that, is because those muscles are so tight that they won't allow you to lie flat. You're also the person who notices that you've lost an inch in your height or some degree over the years. Now, part of that is the fact that you're shrinking, no doubt about it, but part of it is you're doing this because these muscles are tight because you're sitting. You drove here, right? Getting short. You're sitting here, getting short. You're going to go home, watch TV tonight, short, right? So here's the test. You lay down. You sit. Your legs are over the side of the table or the bed. If you want to do this in the dining room table, good luck to you. You might have a spouse that will not like that. Or you can, and you simply lie back down. Now look, I know you're going to say, whoa, I can't lie back down because it's going to kill my back. I'm going down on my elbow. You notice how I did that? You go down on your elbow. You have a whole bunch of pillows under here. Now, some of you already are like, no way. That would kill me. Because you're tight. Some of you are like, oh, I can do that. Then you're going to go to step 2. You're going to bring your legs up. You're going to hold on to one. Ideally, you'll hold on to 2, and you'll bring one back down while you're holding on to the other. Now, I want you to hold on to this one knee, because if you don't hold on to it, see what I just did? See what happened when I let go? I arched my back. Aha. See, I'm sneaky that way. I've seen cheaters before. So I know how you're going to do it. So here you go. You go like this to keep that pelvis locked, and then you go like this. Now, if you're tight, you're going to look like this. Oh, that's it. See how this leg is off the table? That means you're tight. What I would like to see is this. Ooh, I can feel that. And if I want to go for extra credit, I'll try to bend my knee a little bit more. Ooh, you really can't do that. So that's the test. See how I did that? Does everybody get that? Here's the other test. And this is your first exercise of the night. Those of you who've been to my other talks, you know this. I want you to go to bed at night. In the first 5 minutes, I want you to think of me. I want you to think of me. And I want you to lie on your stomach. Now, I'm very specific. None of this is by accident. My feet are over the edge of the bed. Got it? I have pillows under my hips. Because if I don't have pillows under my hips, it's even more of a stretch. And some of you can't even do this. Right? So the more pillows you put under there, the less arched your back is. But you're also stretching your hips. So 2 minutes at night, after your prayers, and before you fall asleep, I want you to think of me, and I want you to start lying on your stomach. That's going to stretch out the front of your hips. When you can do 2 minutes, then you do 3 minutes. When you can do 3 minutes, you do 4 minutes. When you can do 4 minutes, you do 5 minutes. Then when you can do 5 minutes, you take a pillow out. Then when you can do 5 minutes with one pillow, you do 5 minutes with no pillow. Then, if you want to go for the varsity version, no pillows, and bend your knees. Oh my, that is a big stretch. Now, I just took you through a huge progression there, right? You're not going to do that in one night. You're not going to do that in 1 week. That might take you 3 months to do, but that's okay. What exercise can I give you that you don't even have to think about? That's it. That's what I want you to try. That makes sense to everybody? Mm-hmm. Questions? That's hip flexion. That's the front part of your hips. You're not recommending we sleep on your stomach, are you? I always thought that was It's not that bad. It's not that bad. If you could, what? You know, I knew it would be you. I knew sooner or later that would happen. If you're a stomach sleeper and you like to sleep on your stomach, go ahead. Sleep on your stomach. I fall asleep on my stomach. Now, once I fall asleep, all bets are off, and I wind up in a different position. But for whatever reason, my body likes that. Let me show you this, because I do like gadgets. This is a stretch strap. I like gadgets, and I'm very lazy. Watch this. I take this stretch strap. Now, it doesn't give, and it's got loops. I put it around 1 foot. 1 foot. I go ahead and I get in that position again. I think I can do this. Yep. Oh my. Look at that. So I hold on to this hoop. I'm not using my arm strength at all. My arms aren't getting tired because I got the hoop. And you see what I'm doing? That is a great, great hip stretch. And that's how I would stretch. Not herky-jerky, but nice and easy. Right? And this is easy. Right? We have a bunch of them. We use them for everybody. So I like the stretch strap. Let's talk about rotation. Now, there's 2 ways that I test rotation, and I'm going to show them both to you. Why is hip rotation important? You ever see people walk like this? Right? They got that duck walk. It's a hip problem. It's a hip problem because they can't rotate their hips. If you can't rotate your hips, the motion comes from somewhere else, your back. So for those of you who have back pain, I guarantee you, I'll put a $100 bet on it. You have tight hips. How do you know that you have tight hips? Well, your hips rotate. Your hips rotate, for our discussion, I'm going to say about 45 degrees each way. It's really not, but it's close enough for us. How do I test that? This is how you can test it. Your bed. You're sitting up on the side of your bed. Now your legs are over the side of the bed. Now you're going to lie on your side. My hips and knees are at 90 degrees. Everybody understand what that means? Hips and knees at 90 degrees. And then you just let your feet go down. And you compare left side to right side. Now, the weight of your top foot is pushing your bottom foot down. That's internal rotation of your hip. You're going to be like, oh God, I can't do that. Or you'll look like this. If this hip is tight, it won't go down to meet the other one. So what you want to look for is that both of your heels stay together and you can get both of your legs below what I call the horizon. And they should be down. You see kind of the direction, the angle of my lower legs, right? And then all I do is I do this. I do this. And then I do this. Is there a difference? There is. For those of you who are paying attention. I can go down much farther this way than the other way. Even I can tell that, right? And if you have a spouse, this is where you ask them to lovingly pay attention and nag you and tell you which way you go further. I can't go as far that way. So what do I do with that information? I don't need to know the exact number. All I need to know is, hey, I'm going to sleep on this side of the bed. And when I go to bed at night, after I do my Steve prayers, I'm going to do this for 3 minutes. And I'm going to work on my rotation. And I'm going to do it as long as I can. If I can do it for a minute, great. If I can do it for 2 minutes, great. And look, you can already tell that just by doing it a couple times, you see I'm going further? Like you can tell. That's all it takes. Right? So what I'm trying to do is I'm trying to tie some of my exercises to what you guys do every day, which is go to bed. So now you got 2 exercises to do. Right? Hip rotation and the Steve stretch. We talked, and we're leaving flexibility for a little bit, right? Because now you got ideas on how to loosen up your hips. I want to talk about something that's really important: balance. Now, people minimize balance and they poo-poo it, but I'm telling you, as you get older, you lose your ability to balance, to maintain, and to right yourself. And when you do that, you're at risk to fall. And when you fall, you break things. And when you break things, you die. Right now, it's a little bit exaggerated, but actually, the percentage of mortality of people after a hip fracture is disturbingly high. So I'm on a mission to get you all to have better balance, better stability, and not fall. The first thing we have to do is we have to test, how's my balance? There's all kinds of ways you can test your balance. There's 4 simple ways you can test your balance, and I'm going to give you one of them. It's the one-legged standing balance. It's named because you stand on one leg, but this is how you do it. Let me describe what you're seeing. My arms are crossed in front of me. My standing leg, right, is not leaving the ground, obviously, but the leg that's off the ground is not touching the other leg. It's not touching the floor, and I'm not touching a wall or a chair. Under those conditions, you simply count to yourself 1 Mississippi, 2 Mississippi, 3 Mississippi. If you can get to 10, that's lousy. You want to get to 30 on each leg, on either leg. Less than 10, lousy. So you want to shoot for over 10. Everybody got that? One-legged standing balance, I want you to do 30. Now, for those of you over 80, you can drop it down to 20. It's okay. Give you points for your age. But here's now the next thing I want you to do. Here's your next exercise. I want you to work on one-legged standing balance. And what I want you to do at night, you're going to do another Steve exercise. You're going to go to the bathroom. This will be good. You're going to go to the bathroom. You're going to brush your teeth. You're going to look in your bathroom mirror, and you're going to stand on one leg while you're brushing your teeth. You're going to stand on one leg for your uppers. You're going to stand on your other leg for your lowers. Now, I'm very specific. I want you to do it in the bathroom, looking at yourself while you're brushing your teeth. Number 1, because you're going to use the mirror to give yourself visual feedback. And if you don't think you use visual feedback to help your balance, I will ask you to do it with your eyes closed. And you will see how much you use visual cues to help your balance. Right? So you're going to look in the mirror. You're going to watch yourself and you're going to make adjustments. You're doing something with your hand, right? So you're kind of sort of distracted. You're challenging yourself by doing more than one thing at a time. And then finally, you're doing the uppers, the one leg, and then your lowers, the other leg. It should take you about 30 seconds each leg. Make sense? So tonight, I'm getting in your head. I'm with you in the bathroom, brushing teeth. We're doing prayers on our bellies. Then we're doing the hip rotation. Everybody got it? I like standing thigh stretches because you're going to think of doing this at a time when it's not bedtime or when you don't have a strap. And all you need is a kitchen chair and a kitchen table. And all I want you to do is, while you're sitting at the kitchen table, you're going to stand up. You're going to stand up. You're going to face the table. You're going to bend over. And there's a reason for it, right? I told you that these muscles are tight. So if I bend you over like this, it puts those muscles on slack so that you can do the next part of the stretch, which is I want you to put your foot up on the chair. And then finally, I want you to stand up nice and tall. Now, if you want to go for extra credit, extend that leg. Ooh, extend that leg back there. I feel that. Right? Here's where you're going to cheat. You're not going to stand up all the way. You're going to let your leg go out to the side, or you're not going to bring your leg very far back. That's what most of us do. Now, when you get real good at that, and again, have your spouse critique you. Oh boy. If you have one, that'll be great. That'll start an argument. But once you get good at it, then you turn the kitchen chair around. You face away from the kitchen table. You bend over. You put your foot up on the table. You're allowed to. And now you stand up. See the difference? So I just elevated that height. So that's the varsity version of what I just showed you. So I just showed you the progression. Some of you might start like this. I don't know. Some of you might start the other way. That's okay. But I want you to see both of them so you decide what you think you're capable of doing. Does that make sense? Standing thigh stretch. What the heck does a calf stretch have to do with my hip? Remember, I told you how if you got a tight hip, it's going to give you a tight somewhere else, somewhere, including your neck. And in some of these talks, I even include a lot of neck stretches. But I do want to talk about calf stretches because we are all tight in our calves because we just don't stretch them. And the right way to stretch them, see how that knee is straight back there? You don't ever get in that position. You really don't. But here's the other thing that I want you to do, and I'll face you this way so you can see it. Here's the mistaken way of stretching your calf. Oh, I stretch my calf. See what I just did? So if you turn your foot out, you're really doing this, and you're not even stretching the ankle. So if you're going to do a calf stretch, be even a little pigeon-toed, keep that knee ramrod straight, and then lean forward that way. That's a huge difference. Huge difference. Everybody see that? These little differences mean so much, right? Because let's face it, anybody can Google search these exercises. But if you're not doing them exactly the way you should, and you're not getting things out of it that you should, you're going to be like, oh, I tried that stretch and it didn't help. I don't know that you're doing it right. I just don't know.
What is the, if you're not pushing it against the wall, do that kind of stretch up on a step?
Love it. Absolutely love doing that. There's another one that I'm going to show you on the step that I really, really, really love for hips. I'm so close to telling you, but I don't want to. But I'm going to show you, and I guarantee you've never done it before, and I can't wait to show you. Okay, so we talked about the front. Let's talk about your butt, shall we? Now, your butt is weak. I have bad news for you. Your butt is weak. And your butt's weak because you sit on it too much, and you don't use it. Your butt is pretty big, and it's pretty strong, but you don't use it. We have to engage our gluteal muscles, and there's actually 3 gluteal muscles, believe it or not, the minimus, the medius, and the maximus. We all think of the maximus. I'm talking about the maximus, but the medius and the minimus, that could be a whole talk in itself. But let's talk about the maximus. My favorite big old beach booty butt exercise is the bridge. I can't fit any more B's into that sentence. If you do no other exercise, please do this exercise. Please do this exercise. It's so good for you. Because the other thing she's doing in this exercise is look what she's doing to the front part of her hip. She doesn't even realize it, but she's also stretching the front part out. So it's a 2-for-1 special. Look, a bridge. And you say, okay, what's the big deal about that? right? And the further back you go, the higher you can go. And you want to try to go as high as you can. But this is a very ambitious crowd. And I know you always want to do the hard version. Here's the hard version. That's hard. Here's the hardest version. Watch. Oh man. See the difference? Did everybody catch what I did?
Looks like you're gonna fall off the
Yeah.
table.
I used my elbows for support. So that's a little tip, professional tip. Look, oh yeah, I could do that. Now do it like, geez. Right? Try it without that base of support, and you'll find that exercise to be much more effective. And it doesn't take much to do. You can do it in 10 repetitions on each side. The bridge. And here we come to it. Hip hikes. My favorite exercise that you don't do. Now, all you need is a step. And you don't need a big step. This is about a 3-inch step. It's not a big step. Put it down. I step up on it. I'm holding on to something. You can hold on to the wall. I do this on my step going upstairs in the morning, and I hold on to the railing. One leg is hanging, one leg is standing, and I get hippie. This is getting hippie. I used to tell my patients to do a Mae West until everybody said, "Who's that?" And I'm like, okay, no more. Hip hiking. I'm getting hippie. Everybody see me getting hippie? Now I'm keeping my leg straight. All I'm doing is I'm hippie. I'm hinging from this hip. Now what I'm doing is I'm strengthening this right here. Right here. You will feel this here. You might do 3 of them. You might do 4 of them. And you go, I think I've had about enough. That's cool. Eventually you'll build up to 30. And then you'll do sets of 30. And then when you do the other leg, you're going to hang that leg and get hippie. Now I'm trying to let this leg get long and then short, then long and then short. I am comparing my right side to my left side. And I'm kind of assessing myself. Hey, I did 25 on my right leg and I did 5 on my left. Note that. Right? So I can use hip hikes as both a treatment tool and a diagnostic tool. That can identify where you have a problem. You might surprise yourself and find out that the hip opposite your bad hip is the bad hip. Ain't that something? Hip hikes. Love hip hikes. You can do it with a 2-inch block. You can do it with a book. Do it on the stair. I talked about the front of the hips. I talked about the back of the hips, side hips, right? This is where you get that kind of hip pointer, that hip bursitis that comes from a weakness in that muscle. All right, now what? Now what do we do? Great. I told you don't write anything down. One thing you can do is you can go to our YouTube channel and subscribe to it. Yes, I want you to subscribe to it because I have all my hip videos on there. In YouTube, it's Performance Physical Therapy 143. If you forget that, you can just email me and say, what is that? And I'll send you a link. I really like my YouTube channel because I go over all of these videos. I have a whole playlist just on hip exercises. It's free. Please just look at it. Learn something. And of course, I want you to comment and share it, of course. But that's easy. That's do it yourself, right? Then the next level is, and I see a lot of you here, former patients, think about coming back in. You can come in, get a prescription from a doctor. You can come in 3 times if you want and say, check out my hip, show me the exercises, make sure I'm doing them right. I'm off to the races. What I want you to think about this is like that dental exam that you get twice a year. This is like a teeth cleaning for your body. That's what you should think of that like that. And gosh darn it, it's Medicare. They should pay for it, damn it. There you go. I think it's a good use of money. And for those of you who have a real problem, you want to come in for 6 or 12 sessions. That's what a normal course of therapy is. And then we really progress you, make sure you're doing it right. We work on everything. We work on the back as well as the hip. That, I think, is a very easy, compelling proposition for all of you to consider. Plus, most of you have already done it before, so you already know that it works. I think that I have touched on at least one new thing that you haven't known before that you will try, I hope. This is the time for questions, and thanks a ton. Get it? Thanks a ton. Any questions? I'll hang out for a little bit. Thank you for your time and attention. I know you could be home watching Jeopardy probably, but you came out to see me, and I'm very grateful for that. You will be getting an email from me afterwards saying, hey, thanks for coming. Let me know what you thought of it. If there's anything that I could have done differently or better, I have no ego. I'm only interested in improving. I want to make sure that I deliver a great message to you guys. If there's another subject that you would like me to go over, I want you to email me and say, hey, do one on the shoulder, because I've got those ready to go as well. And with that, I'm going to wish everyone a good night, and thank you. Thank you, Vita, for helping me. Thank you, Tricia, for helping me. And I'll see you around. I want to talk to you afterwards.
I do have a question.
Yes.
Okay, I was expecting you to do or to show us like leg swing kind of exercise to help strengthen the side of the hip. So you did hip hiking.
Yeah.
So is there anything wrong with doing like leg swing?
I really would like to show you my favorite leg swing type exercise.
Okay.
And this isn't perfect, but it's close to it. And I normally don't do this, but I'll do this. You know, it makes me sound like a control freak, but if you do it exactly as I tell you, it's a much different exercise. And the exercise that I'm going to show you is side leg lifts.
Okay.
Right? Side leg lifts. And when I tell a patient, okay, do a side leg lift, they're like, oh, yeah, I do that all day. It's no big deal. Right? And they're doing it wrong. And there's only 3 things that you have to do differently, and it makes all the difference in the world. And this takes the place of the leg swing. You need a wall. The hardest part of this exercise is to find a blank wall. Believe it or not, you go home tonight, you will not find a blank wall. You really won't.
Yeah.
Look, I don't even have a blank wall. You have to go into a room to find one, but it's very important, and pretend this is a blank wall. I want you to put everything you got against that wall. That means both of my shoulder blades, both of my butt cheeks, and both of my heels. Now, I'm taking my shoe off. Okay, so step 1 is everything against the wall. Step 2 is heel always stays on the wall. And then the third thing is point your toe towards the floor. Oh my God. Oh my God, that's such a difference. Oh Lord, that is such a difference. I'm locking you into a certain position biomechanically to work the one muscle that you're not working, which is your gluteus minimus. Aha! I showed you the maximus. Now I want to see your minimus. This does your minimus. That's the leg swing exercise that everybody does wrong. I hope you'll try that tonight.
Yeah. Okay. Thank you. Yeah, I like the idea of rolling it in.
Yep, and those are the 3 ways that everybody substitutes their motion and uses a different muscle that's strong, and they don't use the muscle that's weak, because your body wants to do it as efficiently as possible. And that means using the strong muscle. But then you don't use the weak muscle, and then it never gets stronger. And you're like, how come my hip still hurts? I've been doing this damn exercise all the time, but you're not doing it exactly right. Thank you for that question.
All right, well, thank you.
Any other questions? Thank you, everybody. Have a wonderful night.
All right, well, thank you.
All righty.